Tatori, and I am Interim Director of the East-West Center's Pacific Islands Development Program, one of the organizing partners of this webinar, Digital Inclusion, Equity Starts Local. I'm a native Chamorro of the island of Guam, and today convey warm greetings and aloha from the island of Oahu. We humbly acknowledge with respect and gratitude Hawai'i's Kanaka Maoli, the native people of this land. Before we begin the panel discussion, I want to thank our co-organizers, Dr. Peter Hershok of the East-West Center's Professional Development Program, and Bert Lum, Strategy Officer for the Hawaii Broadband Initiative at the Department of Business, Economic Development, and Tourism. Events of this type would not be possible without the support of professional staff working behind the scenes. And today we are grateful for the support of East-West Center staffers, Lori Concepcion, Tolua Samifua, Darylyn Yee, Dr. James Viernes, and Keely Ling. Mahalo to Crystal from Crystal Clear Communications and Makana Delara of the Pacific Islands Development Program for your graphic design support. Permit me to provide some context for today's webinar. Here in the Pacific Islands, we know the importance of relationships and connectedness to other people, places, opportunities, resources, and services. The COVID-19 pandemic has created and exacerbated distance and disconnection, excluding people who lack access to information and communications technology from full engagement in society. Fortunately, local communities, organizations, and individuals like the panelists you will meet today have created and advanced solutions connecting their residents to internet access, reducing inequities and barriers to education, healthcare, other services, and opportunities. In honor of Digital Inclusion Week, we present this webinar in which you will hear stories from some of the most inspiring people working to advance digital inclusion. We hope their stories generate and inspire more solutions across the state, the nation, and the Pacific region. I now pass the mic to our moderator, Bert Lum, one of my favorite fellow tech geeks whose ability to create and activate networks of passionate problem solvers is just one of his many superpowers. Over to you, Bert.
Mahalo, Mary, and thanks to Mary for really kind of pulling together this panel. And I really appreciate the support from Mary and Peter Hershog and East-West Center and the Pacific Island Development Program. So I really want to mahalo all of you for helping to make this happen today. I just want to share a little bit of how we got to where we are. And as Mary mentioned, you know, the pandemic has really brought a lot of attention to some of the disparities that exist within our communities. And when we recognized this back in March of 2022, March of 2020, we convened something at that time that tried to bring together stakeholders as well as providers of resource to see how we can help bridge the digital divide, especially since everybody was now sheltered at home or sequestered at home, you know, work and education, healthcare, access to government services was all pretty much having to be done from someplace other than, you know, the work environment. So we convened this group, and it was at that first meeting that we decided that we would continue to do this gathering every week, and it became the Broadband Hui. And what we've assembled today is representatives of the Broadband Hui that have really stepped up in their corresponding areas to support the effort of what we came to declare, which was the Digital Equity Declaration. And what I wanted to give them an opportunity to do today was to share some of the things that they've been working on and how this is really a community effort. It's a really grassroots effort. It's an effort that for the most part, everybody came together as volunteers and want to see this work continue. And so 80 weeks later, tomorrow will be our 80th consecutive week of meeting the Broadband Hui. The folks that are represented here are a sample some of the people that have stepped up and really embraced, the need to address everything from, and what we came up with something was, it's called Broadband for All, everything from access to literacy to livelihood. And that is something that I think many of us really embrace and take to heart. And so this is not a one-time, let's meet and see if we can solve this. This is an ongoing effort and a challenge that I think we in Hawaii are up for this challenge. And what is very supportive is the fact that I think the federal government has actually stepped up and recognized this challenge as well. So I think there's the community, the people that are assembled here, the recognition by federal government for resources to make things happen. And so I see this as a launching pad for us to really take what we can do in our own respective areas, really nurturing those superpowers that every one of the folks on this event have, and see how can we make Hawaii a better place. So with that, what I want to do is do a quick introduction, and I don't want to steal any thunder from any of the folks, so I will leave the details of what they do for them to talk about. But I have assembled here David Miyashiro, and he will be first up, and he is with Hawaii Kids Can, and he's been a great advocate for education throughout Hawaii. And then he'll be followed by Brad Kaleo Bennett, who is located on the Big Island and has been a community organizer, and from the very start was really involved in getting people connected to the services, not only with access but with hardware, and looking at what is the key elements of bringing community and bringing the right tools for them to use. Next, then we'll have Kelly Withy, and she is with the John A. Burns School of Medicine, and also with an organization called the Area Health Education Center. And she has been taking charge with going out and helping people understand the importance of the technology, but also in the context of telehealth. And how do people actually now access health if they are using the technology like the computer, broadband, and how do they gain some familiarity, with that process? And last but not least, Ka'ala Souza, who has been a champion for digital literacy and taking it upon himself to actually get out into the communities and provide, kind of a basic internet and computer 101 class. And we did one this past Saturday over at IAEA library, and it was great. It was very fun, very entertaining, and that's the kind of energy that Ka'ala brings to the topic of digital literacy, and he will talk about why he's doing it and the goals that we are aspiring to in terms of reaching, this degree of digital literacy across the entire state. And it's an audacious goal. And the only way I think that we can actually achieve that is if we all chip in to try to do our part in achieving it. But I'll leave the details to Ka'ala. And that's the lineup for the panelists. And what I would like everyone to do is kind of start formulating some questions that you might have for the panelists, and I will allow them to speak to the projects that they are involved in, and we can ask them maybe a few questions during their piece, and then we'll save some of the group questions toward the end of the panel. So with that, I will hand it over to David to kick off the panelists' introduction.
Aloha, Bert. Thank you so much, and mahalo to the organizers, the other panelists, and everybody who's joined as part of this conversation today. It's really humbling to be here with you all. I'm David Miyashiro. I'm the executive director of Hawaii Kids Can. We're a local nonprofit that's been in existence since the summer of 2017, so not too long, but we've really looked at how do we bridge that gap between what's happening in our communities and in our schools with what's happening in our state capital and in our policymaking bodies. And for me, that's a really personal mission. I actually started my post-college career as a middle school special education teacher here in our public school system. Experienced that Furlough Friday situation and really wanted to learn more about how do these decisions get made and how can we better involve community members. And so I went from there to Washington, D.C. and basically worked in government and politics for 4 to 5 years before finally coming back home to set down roots here in Hawaii, where my family is. So it's been really humbling to work with Bert and all of these panelists throughout the pandemic to really try to figure out how do we address this digital equity gap. Because we interviewed a mom last year, and she said something that really made it clear to me. For folks who have internet, who can rely on having connectivity at home or at work, it's almost impossible to understand what it's like to not have that. And that was the point that she and so many other parents were making at the start of this pandemic, is that a lot of the assumptions that were built in to support students at that time were built on that assumption that every family did have access at home, or at least some kind of access. And so what that meant is when we spoke with teachers about what was it like when the pandemic was first getting underway, they said that, the schools actually, in many instances, have the computers available. They have Chromebooks and they send them home, but they're getting them back. And the reason was that those Chromebooks really weren't providing much value because the family either didn't have internet access, or maybe they were sharing one cell phone hotspot for a large multi-generational family, right? With folks' jobs getting cut and budgets getting smaller, having an internet connection at home was a luxury. And so the question then for us working with the Broadband Hui was, as education people, how do we leverage all the partnerships and potential partnerships in our community in order to help close that gap? And one of the projects that really came out of that, and Bert probably can help follow up here a little bit too, was Wi-Fi on Wheels, which grew to an initiative with 11 different sites across 4 islands, really looking at how do we provide connectivity in creative ways, including putting routers on vans, putting routers on churches and shelters, but really just trying to make sure that free internet, safe internet was accessible to as many disconnected families as possible.
That's great, David. And I remember when we first talked about Wi-Fi on Wheels, and I remember you mentioning that there were these projects that were kind of popping up on the mainland, and realizing that why can't we do that here? And I think one of the things that we all quickly learned from the early days of convening the Broadband Hui was the fact that there are pieces to the puzzle that we may not all realize need to be addressed in order to make any kind of a connectivity, let's say, project actually work. So David, I mean, when you started to think about Wi-Fi on Wheels, what were some of the things that you learned along the way that needed to happen in order for that to actually, from a connectivity standpoint, actually work?
Yeah, it's a great question, Bert. It's a little bit like, let's say you have a leaky roof in your home, and you go to repair that and you figure out, oh my gosh, this whole foundation is crumbling, right? Now we've got a bigger problem. And I think that's what the pandemic has been in many ways, where, I think for the most part, when things are good and unemployment's at 2% and kids are going to school, somewhat consistently, we can overlook those infrastructure challenges that we have, right? We don't have to have those tough conversations because, we can get by. But I think in this kind of crisis scenario, this is the perfect opportunity while the light is is the brightest to actually go in and try to address some of that. So, to your question, Bert, we found that just access to, wireless connectivity it is a big challenge, and if you ask community members, where do you think the internet comes from? It's an interesting question because people think it's kind of like magic, right? It's coming from satellites in the sky and it just kind of goes magically right into your cell phone, but it's way more complicated than that. And so I'll be the first to say I'm an educator by training and in my heart. So I've had to learn on the fly, what's a cable landing station? I mean, my gosh, that's not something they teach you in education school. But those are the kinds of community education efforts that are needed. There are going to be trade-offs, right? We really value our Aina and our natural environment out here. And so when it comes to the question of, do we create additional cell towers? Do we have to, dig additional broadband, all these kinds of major projects, it's gonna be potentially contentious, right? So again, how do we keep the focus on what are the biggest needs for our kids and our families, and what are the most efficient ways to get them that help that they need?
No, that's great. That's great, David. And in terms of Wi-Fi on wheels, you said that there's multiple locations, and how is it, I guess, progressing after more than a year and a half, in its unfolding?
Yeah, it's been really interesting to see. It was not designed at all as a one-size-fits-all solution. Really, we've worked with each community, and we've been really grateful. And I'd be remiss if I didn't mention some of the partners, including Kamehameha Schools, Partners in Development Foundation, the community college system. There have been so many great folks who have been a part of that journey. And so we've seen, for a lot of communities, the question is, how do we get something that's safe and centrally located? And so, in particular, I want to shout out folks on Hawai'i Island through the Hawaii County Economic Opportunity Council, because they reached out very early in the pandemic about Wi-Fi on wheels, because they heard about an early project we were doing in Waianae, and they've kind of taken it to the next level where their vehicles actually include a whole range of services. So families may show up for the internet, or may show up for nutrition and food, and then they get to stay for all these different additional needs that they have. And so I think, to me, that's where I see kind of the most bang for your buck, right? How do we start to layer and integrate all these services so that the internet is an incentive? And maybe it's okay if families want to come and watch Netflix together, but while they're there, let's get them connected with services and connected with food and other things that they need, right? And so it's been really interesting to see how this model works when it's really community driven. And for me, it's about troubleshooting and supporting those community leaders on the ground so that they are able to provide maximum service to their communities.
Great, that's great, David, and appreciate you bringing up Big Island, because that's a good segue to our next panelist, Brad Kaleo Bennett, which I was reminded I need to make sure that I say all three names so that he acknowledges my calling him out. So Brad, when you got started, and you got started kind of on your own with Kua'uli, and Kua'uli was a collaborative that brought people together to look at getting hardware to families that were perhaps deserving, disenfranchised, unable to get buy a computer, and I want you to talk through that process, and it really kind of helped us connect to not only Brad, but the folks over at Hawaiian Hope, which is Curtis Kropar, and a whole ecosystem that refurbishes computers that were donated from corporate donors, and instead of throwing them away and recycling them, these were actually put into working order, and then got into the hands of some folks that were deserving. But that was just a start. So Brad, I don't want to take anything away. So you go ahead and fill in the blanks of how you got started, and where has this where has this led you? What path has this led you down?
Mahalo, Brett. Thank you for the invitation. Also appreciate being on this panel with all the other panelists. Ironically, through all of this work, we've all been involved in projects together. So, we know each other, we know each other's work. I think we appreciate each other and Bert's leadership in bringing this all together. As far as my entering this work, it started early on in the pandemic. A group of Amidiar fellows were talking, and we noticed that due to the kind of really sudden shutdown of our school system, that a lot of our kids didn't have access to computers. They couldn't access their education just because the computers hadn't been distributed. Nobody really knew what was going on as far as what the distance learning program was going to look like. So there was there was a lot of uncertainty. So we decided that we wanted to get together. Most of us had background in education. My background prior to getting involved with this was I spent over 20 years with the DOE. My last position was complex area superintendent for Hilo and Waikea. So all of us had these experiences with trying to promote student education and community resilience. So we decided we're going to get together and connect with funders and try and get free computers to distribute to our students out in the rural areas, those who didn't have access. We partnered with several groups. We partnered with Hawai'i Energy and Lido Kalani Trust and a couple of other groups. And what we found really, really quickly was that we couldn't get Chromebooks. At the time, the global supply of Chromebooks was completely depleted. They were quoting us 10 to 11 month wait times. So we were actually very fortunate to be connected to Curtis at Hawaiian Hope. So Hawaiian Hope is a nonprofit in Honolulu that collects and refurbishes computers for redistribution. So they give it to us at a very reasonable price. So we are we are able to connect with our funders, find communities in need, and really get computers out to students. And since the start, we've shifted, also giving computers to kupuna as well. So since the pandemic started, we've distributed close to 1,000 computers statewide. And through that work, of course, going out to the communities, listening to people, talking to people about their needs, we became very aware of the fact that, providing hardware was only one part of the solution. And there was a definite need for quality broadband access, especially in our rural areas where the infrastructure didn't exist. So we started doing some work through not just Ku'uli, but through my nonprofit, Oamo Collaborative. And we became involved in first working with Bert and the Broadband Movement, the Digital Equity Declaration that was passed by the legislature last year. And now we are starting a rural broadband mapping initiative in which we are sending people out across the state into our rural areas to measure actual broadband connectivity, ask questions around digital device availability, what their needs are as far as connectivity goes. If they don't have connectivity at home, where do they go to connect? What are the reasons for lack of connectivity? Is it financial? Is it infrastructure? Is it both? And also, if there is a need for continued access in devices so they can access government services and telehealth, which is becoming very important for our kupuna. We don't necessarily want them going out, into the communities to attend doctor's appointments if they can do it from home, from the safety of their home, and then their doctors can, give them the services they need. So we are starting that project. We're going to start our data collection mid-October. We hope for the data collection to end up by end of January, the data analysis to take place in February and March, and hopefully the data be available for sharing publicly after that. So we're looking at probably May or June, where we're going to have it on a dashboard and readily available to share.
Hey, that's great, Brad. And I want to let people know that everybody on this panel pretty much takes the ball and runs with it. And I'm convening people and looking for people to really take charge. And Brad's been one of the champions that has really done that. And Brad, so this data mapping project. So why do you have to crowdsource that? I mean, why can't you get that data, or why can't we get that data from anybody else, like maybe the government, like me, or maybe the carriers? Why isn't data more accessible, and why do you have to send out troops to actually crowdsource this data?
Yeah, and thanks for that question, Brett. And I resonate with David's comment about learning on the fly, because I did not know the reason for this when I first started this work, right? So of course, when we ask for the data from service providers, The answer we invariably get is that the data that we were asking for is proprietary and they won't share it. When we look at our government, our federal government maps or whatever maps are available, the data in those maps are populated by providers self-reporting. So it's very important for us to go out, get some boots on the ground, get people out there and do some actual measurements so that we can kind of, figure out where those maps are accurate, where they're not accurate. Anybody who has a cell phone, has the experience of, looking at your cell phone provider map, going out to a certain area and realizing that you don't have coverage when it says you do. So some of the maps are, they're very broad. So we want to have a little more detailed description of our areas, our neighborhoods, especially our local areas. Crowdsource the data locally through people who live here, people who live in those communities, and ask the questions that need to be asked so that we can make sure we get, hopefully we start moving towards some solutions, right? I mean, the idea is that we can think out of the box and provide community-owned networks. We can look at satellite connections. We can try and work through other nonprofits like Hawaii Kids Can and their Wi-Fi and Wheels project. One of the projects we've worked with David on is setting up a hotspot at Kohala Gym at Kamehameha Park. So there's free Wi-Fi there through partnership with David and Kamehameha Schools. We're trying to get the same thing done in Keaukaha right now. I'm waiting for a meeting with the County of Hawaii. So definitely there are solutions, but we can't go out and implement these solutions without knowing exactly what the data is.
And then Brad, what you are describing is something that your sponsors have helped to fund your efforts, right? Because granted, we could do so much as volunteers, but it's good that the philanthropic support came into play to help get some of the foundation for getting people actually engaged and having them receive something for the work that they've done. So who are some of the sponsors for this data mapping project?
Yeah, no, we're very, very blessed to have private sponsors who come in and help us. Initially, when CARES money was available, we applied to the state for funding for some of this, but I guess there were needs elsewhere that they couldn't really give us money for it. So through the efforts of awesome people, we ended up partnering with Kamehameha Schools, Papa'ololokahi, which is a Native Hawaiian health organization, and the Internet Society are our main sponsors. We also have some help from Pacific Basin Telehealth Resource Center. We are partnering. In fact, Dr. Withy is providing us some in-kind partnership on data analysis and partnership, hopefully, and going out to collect some data. Hawaii Green Growth has agreed to house the results on their Aloha Plus Challenge dashboard once we get it all cleaned up and presented to them. And even the state, the state GIS section, they're extremely helpful with allowing us to use the platform for data collection. So we really appreciate all these partnerships. And honestly, the work would not, you pointed out, the work would not get done without those partners because we just could not find enough people to go out and do this work for free. Yeah.
Yeah, no, that's great. And I think Brad, what you've just expressed is the fact that it's really a team effort. I mean, we can be the faces of the maybe subgroup leadership, but if it's not for all the folks that actually do the funding and the actual boots on the ground, this would never get done. And really bringing back the importance of our goal for digital equity across the entire state. We're kicking this off kind of with Digital Inclusion Week. This is the first time we in Hawaii are participating in this, and we see this as being something that I think we want to bring attention to. And the work that Brad's doing, to me, it's a foundation that helps us establish what our baseline is. And you can never measure where you're going if you don't know where you already are. So if you don't know where you are, going anywhere could be a goal. But if you know where you are and you actually set a goal, then you can measure your accomplishments as you try to reach your goal. So, the work that Brad is doing is super important. And I'm glad you mentioned Kelly and the work that she's doing from the telehealth side, because, telehealth has always been a real strong partner in some of the work that we've been doing with broadband, because if you look at the broadband as an infrastructure, you need the infrastructure in order to deliver some of the applications. And if you look at telehealth as one of those key health applications, how does it get to the people that it needs to get to? And oftentimes telehealth is looking at rural communities. And if rural communities don't have broadband, how are you going to deliver telehealth services? So Kelly, I think, and a number of folks in the telehealth arena really saw an opportunity to, lean forward with the broadband Hui and get involved. And I love the stories where, Kelly and Christina Higa and, the libraries all kind of connected up and, saw a way of leveraging each other's, again, superpower. So Kelly, I don't want to say anything more. I want you to tell the rest of that story.
Oh, I don't even know if I can tell all that. That hasn't actually firmed up completely yet, but I'll tell you a little bit about what I'm doing. So I'm a family doctor. I've worked at the medical school longer than I'm going to admit to anybody. And I've consulted for a number of years for the Hawaii State Rural Health Association. And so when I started with the medical school, all our students were from Oahu, they were on Oahu, they did everything on Oahu. And I said, well, why don't we get them out to the neighbor islands and have them have a rural experience? And then let's get more of them from the neighbor islands so that they'll go back to the neighbor islands. And so my big push was rural training. And I got some grants to do that, and that picked up. And that's actually, until COVID was going really well, we were going to maybe have a mini campus on Maui. We got a residency through Hilo Medical Center, exciting stuff going on. But of course, with COVID, that all stopped because students couldn't go anywhere to train. And so patients couldn't go where they had to go before to actually get care. So I had long been a proponent of telehealth and teleeducation, but the doctors weren't. So the doctors here, I do the physician workforce assessment, so I can tell you we have like 800 less doctors than we would if we were on the continent for a population our size. So our doctors are so busy, they don't have time to do telehealth in addition. So in 2014, when I started asking, 2% of the doctors were willing to do telehealth. In 2020, mid-year, at the last survey, over 50% were. So one of the few good things that came out of COVID was everybody started doing telehealth on the doctor side and the healthcare provider side. But did everybody get access to telehealth on the patient side? Well, no. So we saw a need, and we knew with all the stuff going on that people would need a lot of behavioral health services. So we actually started a free telehealth service, and now it is free for rural folks, including Oahu rural folks, through 2023. So I just put the web address up there. And we wanted to offer help to folks. It was free for the whole state it just ended, but now it's just rural areas. But did we get a whole bunch of people using it? No. So still, what's up with that? So we kind of looked around and we found the three things that were preventing use was a device. All right. So we said, oh, we can give out computers. And actually, Ka'ala is the expert at this. You've heard everybody talk about this. We can do this. Okay, so great. So then everybody could get a device. What's another thing? Well, some people don't know how to use it, especially probably the people who need it the most, the kupuna. So can we teach them to use it? Okay, so we hired some community health workers. They're willing to go out to homes and teach you to use it. Well, in rural areas, people don't want you just to come out to their home. So, okay, we do community events. We teach you to use it. Okay, that's great, but you know what? I don't have internet, or I don't know how to use the internet. Okay, so that's why we thought, well, we should come to your home, see what you have, give you what you don't have. So with Christina Higa and the libraries, we're buying a bunch of hotspots. So you can use it from different areas. Well, that's great, but we started doing our community sessions on Molokai, and I'll tell you, I brought 3 hotspots there. They don't work. So hotspots don't get everywhere. So we're actually looking at satellites, at if there can be more cable to certain areas. But let me tell you a little bit about Molokai. I don't live there. I don't claim to know a lot. I'm just going to tell you my own personal experience, because Rosie Davis, she is the area health education director there. She said, can you come give some telehealth training? We have a food drive. We give out food. We're at Lani Keha Community Center on Hawaiian Homelands. We give out food once a month, third Tuesday, to the Homelands folks. And then we have a free mini clinic. So we'll do their BMI, we'll do their blood sugar, blood pressure, stuff like that. And then you could come and you could give a computer telehealth training. I said, sure. And I can bring some computers and I can bring some hotspots. So I go over there, and luckily Ka'ala's there training too, and he'll tell you about that. And he brought more computers than me. So that was good. Everybody got computers. But the first time I brought an AT&T hotspot because I had one. Maui, somebody from Maui sent me one because they were done with it for the school year. Okay, I don't know if they need it back, but they might. So I tried it. It didn't work. Well, in Molokai, they said, oh, no, Verizon is better. Verizon is the phone we use. So, okay, I go down to Verizon, I buy a prepaid hotspot for $225. And I go over to Molokai and I do my download speed, and it's 0.33. Okay, well, that's better than the AT&T. So then I complain on one of your calls, right, Bert? And T-Mobile says, we'll send you one. And then he says, oh, wait a minute, they don't work very well on Molokai. I don't think it's gonna help. I'm like, okay, hotspots don't work. So I'm sitting in this community center, and luckily I was working with Viasat, and I said, what can you give me for free? Because I'm all about the free. And so they say, well, we can give you a satellite. Where do you need it? And I said, okay, well, I need it either South Shore, Big Island, or Molokai. So Rosie Davis, again, she said, I'll take it. And so they put a satellite on the roof of this Lani Keha Community Center. All right. So this center, actually this center is really lucky. They got a Spectrum cable. So they got some broadband there. Okay. So I'm sitting there, I'm checking it all because Kaleo has told me how to check my download speed, and maybe put that in the chat. Yeah. Because people should be able to do this. And we're going to get everybody doing this. I got an idea for you, Kaleo. We want to have a competition. But anyway, so I checked the regular bandwidth on the cable, 100 megabytes. Okay. And then I checked the satellite, 70 megabytes. Okay, that's not great, but I can work with that. All right. And that's when I checked my hotspot, and it was 0.33. And then I came home to Oahu, and it was 330 megabytes. So, we got what is that? 100,000 difference there. I'm showing I can't do math under pressure. But anyway, so this just makes me mad. This is digital inequity. And then I hear that the internet provider for certain areas of Molokai may go bankrupt and take away all service. So then I want to get satellites for every single house there, but they cost $200 a month. So anyway, we're doing events now on Big Island, Lanai, Molokai, and we really like doing them with Ka'ala because he gives the basic education and the computers, and then we just follow up. We say this is how you do telehealth, because it's not hard to do telehealth, but it's not easy either. You got to know how to use the browser. You got to know what website to put in. You got to know what your doctor uses. And so that's why we thought we'd go into homes and help people connect with their doctors. But now we're doing it in bigger groups. So let me stop there because I think I gave enough for you to give me a tough question. That's for sure.
Well, there's so much that you just shared with us, and it's one thing for the kupuna or patient to better leverage the technology from a telehealth standpoint, but it's also interesting that you have to also train the doctors, right, to actually use this in their practice. And if it wasn't for the pandemic, their interest in telehealth, was very minimal.
Right.
Maybe I'll just ask you, Kelly. I mean, do you think that the lessons learned during the pandemic will be carried on as we move into the new normal? Will telehealth gain a foothold in the ability to provide health services to these communities?
Well, actually, Waianae Comps looked at this, and Christina Higa's looking at this, and it looks like it'll come back down. My guess is about 25% of stuff can be done easily and fairly smoothly by telehealth. And so all it took for the doctors was a big push and money. And then they learned pretty quick. They got up to speed right away. But now they're seeing the benefits of it, both to their practice and to their patients. And so I think it will, not to the extent it is right now, it won't be half of all healthcare, but it'll probably be 20 to 25% of healthcare visits. And I got to tell you, the youth, they don't even want to do video like this. They want to, text their doctor and say, I need this. And the doctors, they're going to do that. That's the way things are changing. So yes, I think it's here to stay.
You also bring up something that's really interesting, and I think this kind of brings all the panelists into the work that they do. So as you talk about Molokai, and as you describe, you have T-Mobile, you have Verizon, you have AT&T from a wireless standpoint, and also you have Hawai'i Tel, you have Charter, and you have Sandwich Isles, all on Molokai. But the question is, why isn't service delivered in a more robust, high quality level for people that live there? And I think no need to answer that, but we collectively need to answer that, because when the federal government looks at funding certain improvements in areas, we need to be able to, from a data standpoint, describe what it is that's actually happening. Not so much anecdotally, but from a data standpoint. How does one community have all these carriers in their community, but still not be able to provide broadband to the degree where it's functional? I mean, better than functional, right? There's no reason why it shouldn't be better than functional. And when we're talking about functional, we're talking about getting to 100 megabits download, at least 20 megabits upload. It's better if you have symmetric 100 up and 100 up and down. So anyway, that's our goal. And Kelly, the work that you folks are doing, and getting the sense of what it is that a community is experiencing is going to be really, really important as we identify communities and how do we improve infrastructure in those communities. And with that, I wanna give Ka'ala a chance to share the work that he's doing, because it's not just about infrastructure. It's all about the ability for the recipients to best leverage the technology. And this is where the literacy comes in. Whether it's David Monsieur working on computer science and education, to doing digital literacy classes, to trying to figure out how do we get computers in people's hands. That's the part of the equation that oftentimes the large carriers don't really think about, because they're more focused on the infrastructure part of it. So from a literacy standpoint, Ka'ala, how are we going to get the entire state up to a level of digital literacy and digital equity that we all would like to achieve via the Digital Equity Declaration? I put that goal on your shoulders, man. My man, my idol, Ka'ala.
No, please. How do you know we're not already there? How do we know that we don't already have 100% digital literacy in our state? We have some anecdotal evidence going around doing some classes. So we're going to say we probably are not at 100%. But I think we all look at 2020 as this pivotal point, like David was saying. Everybody on this panel is such a wealth of information, and it's really it's a privilege and an honor to be a part of this. I want to mahalo to Mary and Peter and the East West Center team for letting me be on this. But even in the chat notes, I'm taking notes on this stuff. and I'm clicking on these things because there's so much resources that are being shared from and Manao from the panelists on this. But during the pandemic, 2020, I think I read something someone said back then that that really highlighted what this inclusion or equity or lack thereof was made to be more front and center. And it was if you were digital already when the pandemic hit, what you did was you became more digital. I don't know if anybody here had to try and find a webcam when the webcams, were like $200, normally $80, and people were scalping them almost on Amazon. And everybody went out and got them. And people were like, the ones who were really late to the party were like, what's a webcam? And, they were behind. So if you were digital, you got more digital. And what they said was if you were not digital or just on the borderline, the gap just increased. And I think that's what we're finding here when we talk about, like even now, like I just realized that I have these computers behind me and it looks like a little, like I have all these computers, but those are some of the computers that we gave away that I'm testing. One of the keyboards doesn't work. I'd taken one of these laptops or a MacBook, their older MacBook laptop, to this kupuna, this family in Waimanalo. And I tried to set up a computer for them. They didn't have internet. We came back with this laptop. I said, finally, let's use your phone as like a little, hotspot here. And I tried to help them put in their password, and the darn W key on the keyboard didn't work. So I'm like, you're kidding me. Because I had asked him, I said, uncle, you use a computer before? You know how to do this stuff? He's like, no. I said, no, like never? Or he's like, no, this is the first time I've ever had a computer in his whole life. Like in my generation, like my grandmother grew up here in Hawaii with a dirt floor. And I feel like that's kind of what it feels like for me when people don't have computers. I came into this kind of not from a digital equity or digital literacy beginning. Like, Bert's always been, for as long as I know, Bert's always been digital. So like he's always been a fixture in this. But I came into it from the Workforce Development Council. It's an office out of the Department of Labor. And we were trying to figure out how to have a resilient workforce. And then we realized that if people have, like, there's so many free resources online at the time during 2020, Microsoft was offering stuff, Coursera, all these free upskilling resources. We're like, great, let's just point people there. But then we realized that people don't, not everybody has the computer or internet access. And then we realized maybe not everybody has the skills to even fill out a form to get us on there. So then we started asking ourselves, well, where is Hawaii in terms of our digital literacy? Where are we at? And we realized that we don't have any data, state level data on that. We have reading literacy. Like Hawaii Literacy is one of our really core partners here. And, they have right on the front of their website, on the front page that, Hawaii's at 16% or 16% of Hawaii's adult residents are not literate, are functionally illiterate here. So they can't read. But we don't have that kind of data for Hawaii, back in 2020. And so we're like, how do we know? It's like the thing that Brad is doing, Brad Kaleo Bennett is doing, is to trying to track where we're at so we can figure out, where we need to go. So we have some ideas on that, Bert. But when you start talking about how do we get to 100%, we could already almost be there. We don't know, but Digital Inclusion Week is happening right now. And I think everybody that has gone before me has already identified some of the things that you need to be included. If you don't have an internet connection, like Dr. Kelly Withey is saying, you can't compete. You're Hawaii, we're out. We're the most rural, remote place in the whole giant world here. And even more so than the rest of the country. It's like, we need this to function here, to take advantage of the opportunities. And when we talk about opportunities, I didn't come into this again for digital literacy. And it's still not my end goal. To have everybody 100% digitally literate is really not the goal. It's just a means to the opportunity for me. The dream really is that you have opportunities to be able to make a living here in Hawaii and stay in Hawaii. That's it. And if you don't have these skills, you can't play. You're going to have to move to Washington State or Vegas, which I'm not against. But if you're forced to because you don't have the skills, then that's the problem for me. And that's the sad problem. But if you don't have the internet, you can't compete. If you don't have a computer, you can't compete. David bringing up the Wi-Fi on wheels is amazing. And it gives people, again, just the opportunity. But if you don't have a computer, and that's what Brad's taking care of. And then what we started realizing, if you have all those things, but it's almost like having a Ferrari, and you have all the horsepower, but you don't know how to drive stick. What are you going to do? You don't know how to use a clutch. we don't, if you don't have the skills to get online, you can't take advantage of the free resources, or you can't upskill, you can't pivot when something comes up that, Uber, Lyft, people who had some digital skills could say, hey, I'm there. I met a guy who picked me up from Uber on Kauai, who was the Pizza Hut manager on his lunch break, and he took some Uber guy, and I was his guy. I'm like, what? And they're just trying to make a hustle here, trying to do this thing. But if you don't have these skills, the other couple big barriers here is language. If you don't speak English, what do we have for you? It's just a huge challenge. We have fantastic resources. I'm going to put them in the link here in the chat with North Star. It's a nonprofit out of Minnesota. But fantastic basic computer skills. But if you don't speak English, you don't understand English, you can't read English, you're out. So we're trying to figure out how to, and we're working with different cities and states to fund this. Hawaii has already contributed. We're like the first state to contribute to this nationwide recoding for North Star to get language accessibility. So we're there because we have, everybody's like, oh, let's get Spanish. I'm like, okay. What about Chinese? What about Chinese? And so they're not as excited in Philadelphia about that as we are, but we're pushing for that. The other one is disabilities. If you are blind or deaf or hard of hearing, I can't help you. I can't teach the class. So we're trying to find real custom solutions for that, for languages, trying to find people who can teach this. It's not overly complicated, but really, when you talk about the 100% goal, I think it started, and Bert and I were talking about this. I remember I was walking around in my backyard with my cell phone talking to Bert, and we were talking about King Kamehameha III back in the 1800s. King Kamehameha the Great, the first died in 1819. I think the missionaries came in 1820. Kaleo took over as the king, Kamehameha III, shortly after, like 1823 or so. And one of the first things he said was this proclamation. I said, hey, Aupuni Palapala Ko'u, that mine is going to be a kingdom of literacy. We had already had the printing press in Hawaii with the first missionaries' arrival. On the Thaddeus, on that ship, the first printing press came in, and already we're recognizing that we need to be literate. We need to be able to read. And the kingdom recognized that and supported it. And within like a generation, I think Hawaii had one of the highest reading literacy rates of any nation in the world. So to put this into perspective, the worldwide reading literacy rate, was estimated at about 19%, 19. The United States of America at the time was about 78%. Hawaii was estimated at 91% plus of the population in the kingdom could read. And it was amazing. People were tripping. And I think what we want to try and get to is to bring Hawaii to that same kind of level with digital literacy. So, I'm looking at 91%, but really, Bert, you're right. It should be 100. And coincidentally, we just are getting the final report from OmniTrack, which we did a phone survey, statewide phone survey over the last several months, a sample size of like 900 people. We can get into counties, but not zip codes. But just to answer the question, where are we? So we can tell Bert, are we there yet? And honestly, at this point, we're not. We're just not there. We're going to be able to we're doing a presentation on the 27th, the DXP thing, and I put that in the chat, a link in the chat. But we're not there. We'll probably have, maybe 30% of our population right now is going to not be able to get on this telehealth thing with Dr. Withy. He's not going to be able to even know how to set up their broadband. So I'm going to stop there and then drop some things into the chat over there, Bert.
Hey, thanks, Kaala. And I think to Kaala's point, we are all trying to be more competitive in this 21st century that we are well into, and the digital economy is not something unknown to anyone. We all pretty much rely on it, and if you have been using a computer or a smartphone and you are adept at accessing websites, then you're familiar. But there are many people that are still having struggles trying to get access, and there have been people saying that broadband is a right, just like you have water and electricity. But if you really take that issue around broadband as a right and you unpack it and you take all the things that you've heard from our panelists, that there are many issues about making broadband as useful for everyone to be this active, competitive participant in the 21st century. And it's much more complex than having water come out of your faucet. I mean, although that's still complex in and of itself, but from a broadband access standpoint, from a literacy standpoint, from an affordability standpoint, from accessing to hardware, even the exercise that we did this weekend, one of the poor kupuna, she was trying to get an email address, and her email address needed to be verified on a smartphone. Well, so she put in her smartphone, she clicked submit, it sent her a verification notification, but she didn't know how to check the notification on her smartphone. So she kept doing it, and then to the point where the number was deemed too many uses. So you can't use this number anymore. So by that time, I'm being called over to figure out how can she get an email account if her phone isn't going to be accepting any more notifications. Well, we had to put somebody else's phone number in. We got that woman to take a look at it, and it turns out the reason why she didn't put her notification in was because she didn't know how to do that. She didn't know how to check her phone for a notification. So, there's simple things like that prevent people from actually getting on, and we collectively need to overcome or help people overcome that. So that's why it's a community effort, between David and Brad, Kaleo, Bennett, and Kelly and Ka'ala, all the work that we are respectively doing to the detail of helping kupuna, change a phone number is what it means to have broadband as a right. And again, not one person is going to do that. This has got to be done collectively across, the entire spectrum of the people that are literate, digital literate, helping the people that perhaps aren't. So again, I want to thank everybody for being a part of this panel. I want to thank David and Brad and Kelly and Ka'ala for showing their leadership in all the work that they're doing. I want to thank Mary and Peter and the staff over at East West Center and the Pacific Island Development Program for allowing us to be a part of this panel. And again, Mary, mahalo for organizing this, and I want to leave it to you to close us out for this great, I think, digital inclusion, equity starts local.
Mahalo, Bert, and thank you to all involved in this webinar on camera and behind the scenes. And thank you all for joining us today. As you've heard, the pandemic has widened the digital divide and has threatened the well-being, success, and in some cases, the very survival of many in our state. As Ka'ala said, digital literacy is the gateway to the future. Our health as a state is dependent on the well-being of all of its residents. Digital inclusion for all of our people is a lofty goal, but as Bert said, audacious goals are possible if we all chip in and do our part. We all believe that together we can achieve this goal. You've heard stories of progress led by our inspiring panelists, and we invite you to join us in this effort. And how can you help? First, I ask you to imagine how your daily life would be impacted if you did not have access to the internet. What would that mean for your quality of life? Take some time to imagine this scenario and recognize that some people, perhaps your neighbors, your friends, Keiki and Kupuna, don't have to imagine. It is their reality. Then, with that appreciation for the harsh realities of digital inequity that exist in our islands, continue to learn more about this issue. We shared some great links in the chat box today, and you can join or follow the work of the Hawai'i Broadband Hui. As you learn about digital inequities, speak out, raise awareness, donate your time, talents, resources, and other things that you have to offer to our organizations and communities in need. We recommend that you start local with those in your own community, the schools in your neighborhood, the public housing complexes nearby, the nonprofits, and people like our panelists who are all working on this effort. Working together, we can ensure that all of our people can be fully engaged in and contribute to our society. Mahalo and aloha. Thank you for joining us.